To complete the infection prevention risk assessment, click on the Infection Prevention Assessment tab. The patient details are displayed on the top part of the page. You are then required to identify the risks of infection and identify the need for a side room isolation for your patient. These risk assessments should be completed within 12 hours of the patient admitted to your area. The first question asks you to ask the patient if they have ever been notified that they are at risk of CJD or variant CJD for public health purposes. If they answer yes, tick the yes box. You will then need to refer to the CJD policy number 19 for further information, as this has an impact on instruments that may be required to be used during a patient's surgical or endoscopic procedures. The second question, has the patient been an inpatient in another hospital in the last 12 months? If they answer yes, you then need to follow the policy for multi-drug resistant organism. There is a section at the back of this policy, number 22. If you've answered yes to this question and the patient has been in another hospital, either in the UK or abroad in the last 12 months, your patient is required to be isolated and needs 3 rectal swabs taken 48 hours apart, the first one being their admission day. They are then in isolation until you have 3 negative screens. If there are any positive, the Infection Prevention Control team will be in touch. The next part of the document requires you to complete if your patient has a notifiable disease or is suspected of having a notifiable disease, as detailed below. If your patient has any of these conditions or suspected conditions, you would tick appropriately. So if our patient had measles, you would tick the measles box. A hover down box appears, which gives additional information. You are then required to complete if your patient has a history of an alert organism, as detailed below, or an alert condition, as detailed below. If the patient had Clostridium difficile as a confirmed and a history, there's a drop-down box. If your patient had an alert condition, diarrhea and/or vomiting, there is a drop-down box that identifies further actions required or further information for you to follow. The next part of the document requires you to complete the risk factors to identify if your patient requires a side room and is a high risk, a medium risk, or a low risk. The high risk conditions that are in addition to determine if a patient requires a side room immediately consist of 6 factors. Is the organism an airborne transmitted type? Is it a highly contagious organism? Is the patient likely to wander into other bed spaces? Has the patient a skin organism and has an extensive exfoliating disease such as eczema or psoriasis? Has the patient any unknown risks, or is the patient immunocompromised? So our patient has measles and yes, a notifiable disease, which is a highly contagious organism. So it's a high risk, which would need a side room isolation. Does the patient have an alert condition or an alert organism? Our patient has Clostridium difficile, which is high risk. And the following actions or an indicator to help you make your decision. Does the patient have a past history of an alert condition or an alert organism? They currently have Clostridium difficile. Does the patient have a past history of MRSA? If, for example, our patient had MRSA but has had 3 negative screens since they were first positive, they would be classed as a low risk. However, our patient already has 3 high risk factors. Any one high tick in any of those risk factors is an automatic need for a single room. Is the patient being directly admitted from another care provider or has been an inpatient in the last 12 months? We would tick high and isolate and perform CRE screens. If our patient was immunocompromised only and had none of the above risk factors, meaning they were in a state of neutropenia, they would be high and require protective isolation in a single room, which is different to source isolation. This risk assessment needs completing and reassessing whenever the patient is transferred between wards and departments. It also would need completing if the patient is transferred off-site and the notes are going with them to another hospital, for example, and an inter-healthcare transfer form will be completed. If, once we've undertaken our risk assessment and our patient requires a single room, if you've identified that there are additional factors to take into account and you felt that the doors of the side room door would need to be open, meaning the policy would be non-compliance, you need to require a completion of this next risk assessment. You need to document the reason why you would want to keep the door open in a side room, for example, or nurse the patient in a bay. You would then need to tick whatever actions you've taken as well. So you will complete the high, for example, for this patient, and the reason that you need to leave the doors open. If your patient was required to be isolated in a bay, you would ensure as one of your actions that you would nurse the patient in the bed or move the patient into the bed next to the sink in that bay and continue isolation within the bed space. And then click Add. If your patient has had a diarrhea illness or been admitted with an infectious diarrhea, you would use the Bristol stool chart to record the type. You check the patient's normal stool pattern and record in the GAD. If the patient has diarrhea of type 5, 6 or 7 and thought to be infectious, you would tick yes, isolate your patient and obtain a specimen and document in the GAD the time that you obtain the sample and the time that you move your patient into isolation. If your patient is required to be transferred to another facility and isolation is required, you have completed a further risk assessment and determined they are still a high or medium risk, then you need to contact that receiving trust's infection control team and make them aware of the transfer and reasons, and tick yes. If there were any other infection risk present, you would also inform the ambulance service and tick yes. However, this patient has currently just been admitted, so we don't need to complete this part. Once all the boxes are ticked, you then click and save and complete the form. This is now a permanent record. If you checked through and you felt there were some errors or mistakes, you can click on the strike through. Once you're happy, currently you are asked to print the document, clicking on both print tabs, and once it's printed, filing the patient's notes in the GAD document.